Hi, this is John Tare. I'm President and CEO of the Boulder Chamber, and I welcome you to one of our industry-specific education sessions for business reopening. This one is focused on limited healthcare settings, and we are going to get very specific with that industry. But before we get started, I just have a few acknowledgments that I wanted to offer. First of all, I wanted to thank you, the audience, for participating. Our goal is to get your businesses up and running, and your commitment of time to make sure that you understand the practices that you need to follow to do that safely for your customers and for your workforce is absolutely critical to that goal. I mean, we know we want to get our economy rolling, but getting businesses open is absolutely critical to that. But we got to make sure that we do it in a safe and publicly health protective manner. So thank you for your time you're committing to this. I also want to thank our other partner chambers and economic development agencies from across the Boulder County. This has been a partnership effort. Their work is supporting your businesses and your success. So all together, those chambers and economic development agencies deserve your support and appreciation. They're doing great work for our businesses. And then finally, I want to make sure to acknowledge folks you're going to meet today, but a larger team that's involved, and that's Boulder County Public Health. They have been a great resource for us. They recognize that and heard us that we want to work hard to get our businesses open. And they've been working very diligently with us to develop safe practices for our businesses that are sensitive to the unique industries that we all serve. Of course, we all have a shared goal of getting businesses up and running and keeping them running. And so following these safe practices, keeping the public safe, healthy is absolutely critical to that. We cannot go backwards. So what today's education session is going to look like is we're going to start with just a general outline of the timeline for the new procedures for safer at home operations and some general basic principles around public health protection in the workplace. And then we're going to narrowly focus in on that limited healthcare setting. Want to make sure that you know that some of the regulations that we're going to be following are state mandates and they are not to be changed. And there's other elements that are focused and elements that Boulder County recognizes as critical to protecting public health. But all along the way, I want to acknowledge that Boulder County Public Health has been very thoughtful in listening to our businesses and the different industry sectors and responding. In fact, last week we had a number of feedback sessions where they presented some draft regulations and they've made specific adjustments in response to that. So I want to thank them for their flexibility and listening to our feedback. So with that, let's just get the program rolling. And we're going to start with Zach Swank, who is the Business and Events Liaison for Boulder County Public Health. Zach, thank you so much for you and your team for working with us, and take it away.
Thanks, John, and thank you to the Boulder Chamber for hosting these sessions. Thank you to our other chambers across Boulder County and other economic partners for supporting them. So, Jesse, if you want to advance. There we are. So today we're going to get into what's allowed, how to do it safely, and the resources that are available to support you. And we should have about a half hour for your Q&A at the end. So limited healthcare, it's a bit challenging of a sector to sometimes identify what you're in or not. For example, massage therapy could be in personal services, or it could be in limited healthcare, depending on where your facility is located and whether or not it's part of a physician-ordered treatment protocol. So, but this is generally who we're talking about, and we'll go into the next slide. So our timeline, as everyone is well aware, we've been under the state stay-at-home order since March 26th. Boulder County extended that order in order to have more time to prepare for safer at home. And now starting on Saturday, Boulder County will revert to the state safer at home order plus a face covering order that Boulder County's put in place. But I want to just reiterate, and really can't say this enough, that we are in a new normal, and we're going to be under some version of some order until we have a vaccine, treatment, or herd immunity. So this is going to be months, not weeks, and just good to keep that in mind and prepare yourselves and your businesses that come the end of May. We're still not going to be right back to where we were in in February or January. So as mentioned, we are still under the stay-at-home order until Saturday, same as the last 5 weeks, with curbside allowed for retail. And then now coming Saturday, we have the face covering order for Boulder County coming in place. Obviously, City of Boulder is already under a face covering order. And then we're preparing for safer at home on Saturday. So the face covering order for Boulder County is pretty simple. If you're outside of your residence, you need to be wearing a face covering if you're going to be within 6 feet from someone. And in general, really just best practice. We're developing a mask culture, and masks and face coverings are going to be with us again until we have a vaccine or treatment or herd immunity. So really just best practice to be wearing a mask at all times if you can, with the exceptions of if it's not safe for medical or other reasons. If you're alone, you're outside your residence, but you're the only person in the building you're in, for example, or for children under 12. So what is safer at home? It's important to emphasize that the degree of contagiousness of COVID-19 has not changed, even though we are changing how we're responding to it. But it is critical to continue to stay at home as much as possible, to stay physically isolated from other people to limit the spread of the disease. Businesses are now open with some restrictions, and this is really new territory for all of us, and we're all navigating what this looks like together. And we should note that some high risk exposure businesses are still not permitted.
So I can take over here, Zach, if you'd like.
Yep. Go ahead,
my name
Jesse.
is Jesse Rounds. I'm the Limited Healthcare Liaison for Public Health. And I just want to go over some details about what is limited healthcare, what limited healthcare businesses can do, and then we'll get into some more details. So limited healthcare is healthcare related activities. And what we mean by that and what the state means by that is if it's prescribed by a physician or if it's part of treatment for a condition that is prescribed by a physician, then that is a limited healthcare related activity. The other things that will be allowed are elective procedures. Again, in that limited healthcare setting, elective procedures will be permitted. And one of the details that I did want to mention is that when doing these things, patients still need to be wearing a cloth mask or face covering at all times. So the compliance checklist, which I can I will share in a little bit, but the order, the safer at home order is mandatory. All of the compliance with that order is mandatory. The checklist that we're providing that'll be available on our website and through the chamber is voluntary. It's really a compliance aid. It's a way for you to check to make sure that you're complying with the order. It's a way to communicate with your customers and your patients that you're complying. And my understanding is that the Chamber and Boulder County Public Health have put the posters out there available on our website, I believe, and maybe on the Chamber's website as well. Enforcement of the order, we're starting with voluntary compliance. We're asking that businesses comply with the order voluntarily. If we, and we're using these sessions as a way to educate and to find out what's confusing and try to clarify issues. If there are compliance issues into the future as the order comes into play, we may ask that the checklist become well, that you follow that checklist. And if we continue to see violations of the order, the public health does have the power to issue orders to close or pursue civil action if necessary. So I wanted to just dig into a couple issues or a couple of the checklist items that I think are really important at the different levels in the checklist. In terms of workspaces at the particular businesses, individual exam rooms need to be cleaned between clients. A lot of the general guidance is that sanitizing high touch areas and making sure that all of the spaces in your business are clean is important. But in terms of limited healthcare, exam rooms need to be cleaned, sanitized between clients each time. And the state is still encouraging telehealth if possible. That's to protect you and your clients. In terms of employees, all employees must receive a health screening before they can show up at work. They are permitted to do that health screening personally and report to the business that they have done the health screening and prove that they are healthy to be at work. And employees, and this is a bit different from other businesses, employees must wear medical grade gloves and masks. For employees, the cloth masks, the homemade masks are not appropriate, at least in the limited healthcare setting. For customers, on the other hand, cloth masks are appropriate. Also for customers, the state is requiring appointment only for limited healthcare. They're encouraging virtual waiting rooms where your clients can wait in the parking lot and they're texted or called when their appointment comes. This allows you to limit the number of people in your practice at any one time. And then again, I just wanted to reiterate the cleaning rooms after each appointment. That's the state's really pushing that, and I think we think it's a really important way to protect both your employees and your clients. So after the last session last week, we got a lot of great questions. A lot of them were the same across various industries. This first one definitely was in every session, and where can we get additional PPE? The state, the county, and the Chamber of Commerce are all producing or are looking to provide more information on that. If you go on our websites, we're developing resources for that. The state is looking into a marketplace for that. That is a partnership between various levels of government and the Chambers of Commerce as well. What is the difference between personal service and limited healthcare? Touched on it a little bit before, but really it has to do with what is the reason for that particular activity. If it's massage that's prescribed as part of treatment for a condition, that's a limited healthcare. If it's part of a treatment regime, that's limited healthcare. And then in terms of accommodations for patients, there were questions about if people are hard of hearing, because some of the services that are provided at limited healthcare are hearing aid fittings and things like that. If both the employee and the patient can wear masks and still provide the service, then it is possible to provide the service. If the patient cannot wear a mask and if the service requires the patient to take off a mask, then that service cannot be provided under the Safer at Home guidance. And I just wanted to point out a couple information sources. And I'm going to stop sharing for a moment, and then I will take you to these two websites that I've got highlighted here. I just want to show you those resources. One moment. Oh, sorry. So this is the covid19.colorado.gov website. This website has a ton of information. It digs deep into each industry. And down at the bottom here, there are various safer at home guidance for particular industries. And up at the, if you click on this information for outbreak, you can actually dig into, I'm sorry, this link here takes you to specific information about limited healthcare in various industries. The other website is a Boulder County website, and it's right here. This is our website about safer at home, and it's taking its time to load here, but there's information about the public health orders that Boulder County has put out, as well as guidance for businesses.
Jesse, if I may, on the Boulder County site, there's also a list of resources for PPE.
Oh, thank you. Yes.
That list is the compiled list of places that we found where it can be attained, as well as some folks who've reached out to us to let us know that they have it available. We do continue to encourage you to get it from whatever source you can, but there is a list there that can help give you some places to start looking.
Great. Thank you, Zach. All right, now let me switch back to my presentation here. So there are other sources, just the bouldercounty.org website, the main page has information on it. The Chamber of Commerce has information. Your industry associations have a ton of information that they've developed across the country. And then DORA, the state of Colorado's licensing association, if your industry is governed by DORA, the Department of Regulatory Agencies, that has additional information.
Hey, Jesse, I'm not sure you're sharing.
Oh, okay, still
slide.
not sharing. Okay, thank you.
Yeah.
Does everybody see it now? Great, okay. And I'm almost done, I promise. Just want to share our contact information. If you have questions, if you have concerns, contact us at the call center at the number here, or email our business specific email address, and you can, and we will respond to those. We have a team of liaisons who are split up by industry who can try and address specific questions. And I just wanted to share the next session, and correct me if I'm wrong here, but it is next Tuesday, May 12th at 3 p.m. And this is the link to that session. And
Hey,
that's
Jesse,
all. Yep, that's all I got.
we're going to have those sessions weekly for limited healthcare. They will be every Tuesday for the next couple weeks at 3 p.m. So when you are finished with this webinar, you'll get an email from me. I'm Corinne Waldow from the Boulder Chamber with links to those resources, links to the checklist, this presentation, and links to sign up for future discussions, to be able to ask questions, to give feedback, to talk about how it's going. How's getting PPE going? Just those types of discussions that we can talk about on future calls.
As well as to get the most recent updates on this order, which is going to continue to evolve. There's already been one update to it since it came out.
So Jesse, can you talk a little bit about the difference between limited healthcare and dental practices and whether or not you're talking about dental practices?
Absolutely. So dental practices are not part of this limited healthcare field. Dental practices are treated differently. And again, if you go on the covid19.colorado.gov, or if you actually look at our checklist, there's actually a couple links to the medical field guidance that's been in place for some weeks. And that includes medical practices and dental practices, and vets are under that sort of cone of businesses.
If it's a treatment that is elective, not necessarily prescribed by a physician, but is certainly part of health treatment, is that allowed or is it not?
So it's not that it's allowed or not allowed. It's just what industry group it falls under. And if it's not part of a medical treatment prescribed by a physician, then it would be a personal service like massage therapy. Massage therapy is a common one that falls in both categories. And massage therapy is now, will be permitted as of May 9th. It's just the requirements to do that are different.
But if people want to have elective procedures, are they allowed to have elective procedures?
Elective procedures that are part of, yeah, sorry. I see the question and I still didn't answer it. If it's part of a health treatment that was prescribed by a physician, then yes, that elective procedure can go forward. And yeah, and even if it was an elective procedure and it fell in the personal services, it can still go forward as of May 9th.
Okay. If we have yet to obtain medical grade PPE, are we discouraged to start seeing clients and patients on May 9th?
If you do not have medical grade PPE, you cannot see patients on May 9th, or until you have medical grade PPE for employees.
And one of the questions that we've gotten in previous ones, but I think I'm going to ask here, are you required to provide your employees PPE?
Yes.
And Zach, will you go into a little detail about the OSHA piece on that?
Sure. Yeah. So, I mean, it's just like any, required PPE for any business. It is part of you making a safe work environment for your employees, and so it is required to provide, PPE related to COVID as an employer for your employees.
Are you required to provide it for your clients coming in? Can they bring their own?
They can bring their own. A business can provide them if they'd like, but because the facial covering order is going to be in place, everyone's going to need to be wearing them anyway. So hopefully people are entering your business with PPE on, or with face coverings on, sorry.
Okay. Acupuncture done in private practice is considered limited healthcare, right? Or is this considered personal services?
Again, it depends on if it's medically prescribed. If it's prescribed as part of a medical treatment, whether it's done in private practice or not, it is limited healthcare. If it's not as part of a medical treatment, then it's personal service.
Another question about personal services versus limited healthcare, which we knew we would get. So if a massage is medically prescribed, can a therapist touch a client without gloves?
Zach, I'm embarrassed to say I'm not totally sure what the personal service rules are with regards to gloves. If it is medically prescribed, I believe you can, as long as you're washing your hands regularly.
So personal services, the requirement is to wear gloves unless it's not feasible or appropriate, and then in which case you need meticulous hand washing.
And that would be the same thing. for limited healthcare.
So for both limited healthcare and personal services and the massage, it's the same treatment of gloves.
Yes. Yeah.
Okay. Do we have any other questions out there? Ooh, here we go. Okay, one-on-one close contact services such as massage, acupuncture in a health setting. Oh, someone was just clarifying.
So if you receive word that a client that you've recently treated has tested positive, then I believe, Zach, they need to quarantine and not provide any more services until they're cleared.
Yeah, so this is it's highly situational dependent. And it's difficult to answer in a ubiquitous manner. The question here is, for one-on-one close contact with a client that has tested positive for COVID, I would encourage you to contact us at covidbiz@bouldercounty.org, and we will connect you to our epidemiologist team who can give you a customized response as to what's appropriate. It would be easy to say, anyone that's had contact with anybody who's tested positive, no matter what the level of contact is, needs to shut down their business, right? The blanket approach, highly effective for public health, highly disruptive to your business, highly disruptive to our society. So we want to be more surgical and provide customized individual guidance. So I apologize that I can't answer that question now, but if you reach out to us at covidbiz@bouldercounty.org, we will get you the custom answer. Which also raises something else I want to share. Any probable or confirmed COVID cases at a facility, if you have 2 or more, it is required that you report to Boulder County Public Health and report to the state. It is legally considered an outbreak and it has required follow-up. That information is available at boco.org/COVID-19.
Great. Can we still use table warmers or biomat while providing a massage or acupuncture session?
So I think as a broad answer to that, if you can use those tools and still ensure that both the provider and patient are maintaining all of the PPE requirements, then yes.
All right. Do we have to remove all soft surfaces such as rugs, pillows, etc. from our offices? How should design of offices also be covered?
That has not been required by the order. That Zach, I don't know if you have any additional guidance on that.
No, yeah, it's not addressed by the order. I mean, obviously, any things you can do, broadly speaking, to reduce contact. Thinking of take out the magazines out of your waiting lobby, right? Anything that provides less things for people to touch is positive, but there's nothing specific that addresses soft surfaces in particular.
Okay. We know rooms must be sanitized after each client. What about cleaning floors?
So again, in the exam room, the way the order is written, it says you must sanitize the exam room. So I would say that includes the floor of the exam room as well.
Can you talk a little bit about access to sanitizers and cleaning solutions and ways that people can create cleaning solutions?
So again, the on our Boulder County website, that link to information about sources for materials includes sanitizers, and there are, I believe, on the CDPHE, the Public Health and Environment for the state, they have tools for how to create sanitizing liquids as well.
Okay. So one question, there's a follow-up to your last answer about the floors. What if the floor is a carpet?
That's a great question. I think vacuuming the floor would be helpful, but Zach,
Yeah, I mean, the concern is mostly high touch surfaces, and obviously, you know, in a healthcare setting where you may, you know, be perhaps a little more likely to encounter someone who is ill, you know, all the more important. But you know, the primary concern is high touch surfaces. Anything that anybody might come in contact with their hands, which then touching their face with, you know, tracking things across the floors with your shoes. You know, sure, if you rub the bottom of your shoe and then touch your face, you know, it's possible that you could contract it that way. But to me, that seems like a low risk scenario. So there's nothing in the order that addresses, you know, carpeted surfaces versus non-carpeted surfaces. So treat it all the same and you know, clean as you can. Another note though on carpeted surfaces, is just think about a vacuum and the amount of you know, air disturbance that's going to cause. And I would caution about, you know, weighing the risks of, you know, cleaning the debris out of the carpet versus redistributing particles, you know, throughout the room.
We're getting a lot of questions about soft surfaces. Zach, can you talk a little bit about how the COVID virus lasts on soft surfaces and cleaning mechanisms for that?
Sure. So the evidence that I've seen, and bear in mind that this is changing all the time, and you know, there's lots of research continuing to come out, but the evidence that I've seen, and feel free to anybody to chat and correct me if I'm wrong here, if you've got something more up to date, is that COVID actually persists longer on hard surfaces than soft surfaces. And, you know, soft surfaces is, you know, it's a broad category, right? You know, you'd be reasonable to expect that, you know, it might persist in a different manner on polyester than it might on cotton versus, you know, wool versus, you know, other things. So the research is still out on that, and we don't have, Boulder County Public Health does not have any official guidance on, you know, how long it can persist on soft surfaces because of how, you know, how new this disease is to us.
And if there's soft surfaces that that patients or clients would certainly touch and can be removed, do you suggest they remove them?
Yeah, I would say anything, you know, soft, hard, in between. You know, if it's a surface that would encourage, you know, contact by your patients and clients, but it's not necessary to your operation, I would recommend removing that. Yeah.
And I would add to that, the guidance from the state really does encourage, and I know there are soft surfaces in a lot of different rooms, but if you eliminate the waiting room, that's a common place where there are couches and chairs and pillows. If you don't have that if you're making people wait outside in their cars, you eliminate that contact.
Yeah, a virtual waiting room would certainly be, you know, the best practice.
I've seen a couple companies say they're going to text you when you can come to the door and only allowing the client in at the time of their service. So those are some best practices that are being currently used. So as a provider of personal service or limited health service, even if we show no signs of COVID, are we encouraged to get COVID testing?
We don't have, I don't have particular guidance on that at this time. You know, we are getting more access to testing. Certainly we will get to a point where definitely we want, you know, particularly individuals that are, you know, coming into contact with a lot of others to have regular testing. But I would not go so far as to encourage that at this time. All
right, we have some nervous massage therapists out there who, I think there's still confusion as to the difference between massage therapists and limited healthcare and massage therapists and personal services. If it's in personal services, they don't need a prescription, correct? They can still give massage to people.
Absolutely.
So could you just set their minds at ease a little bit that they can still see clients without a prescription?
So absolutely, the difference is what checklist you want to be looking at. If you're providing massage as part of a medical therapy, then you need to follow the limited healthcare checklist. If you're providing it as anything other than that, then it is a personal service, which is absolutely permitted. It's just, it has a different checklist. And those checklists, both checklists are available on our website, and the chamber has them, and you all have been sending them out to everyone. So they are available. And, you know, I encourage you to check both checklists. And one way to do it maybe for all of the massage therapists, especially ones that may do both medically prescribed massage as well as non-medically prescribed massage, is to look at both checklists, see where they overlap. And if you have any concerns that you or your business can't provide some part of the checklist for one or the other, get in touch with us, email us, and we can walk through that on an individual basis with a business owner.
Okay. Do we need air purifier in our room if it doesn't have windows?
That is not part of the order.
Yeah, couldn't hurt.
Yeah, exactly. Yeah.
I mean, aside from, you know, the circulation of air, but, you know, so long as it is a high, you know, a high quality air purifier that's filtering, you know, specifically rated to filter out viruses, then yes. But note that many air purifiers may not actually filter out viruses, and then all you would be doing is just moving around air in your space without a benefit.
And that's I see the next question here. Someone asked about fans, and that's an example of a way of just moving air around. It would not clean the air. It would just move it around. So the ventilation that they're referring to in the order is more the building ventilation system, the vents and air movement system.
Okay, just to clarify, we're going to be sending out the checklist in an email, but I'm also going to put in the chat box the link to the resource page that the Boulder County has, and I'll re-link the checklist. Also, to make it helpful, I'm going to put in the personal services checklist link at the bottom of the email so that you can, your massage therapist, check the difference between the two of those. Some more questions. We have, how often do we need to clean or change N95 masks?
Zach, do you?
Sure, yeah. So you should not, unless you have a adequate sterilization process, you should not be reusing N95 masks. And then changing them, you know, ideally, if you have supply available, changing them between clients. Recognize that supply is challenging. So, you know, if you don't have the, you know, the order does not require you to change between clients, though that would certainly be a best practice. But, you know, I would not reuse an N95 mask the next day that, you know, hadn't been adequately and clinically sterilized.
Can you talk a little bit about best practices of glove use? We've had this question a bunch about cross-contamination gloves. I know a lot of people on these calls know that, but similar with the glove use.
Sure, and yeah, with gloves, changing between patients, changing when you leave a room, that you're moving that those gloves to a different place, they could get contaminated in a different space. So I think changing between patients, using them in an exam room, removing them, that's going to be your best bet.
All right, I have one more question here. Any guidance or recommendations for scrubs or body coverings?
So, Zach, you may have the best information on clothing, but I believe clothing needs to, the virus can sustain on clothing for some time, and so there's a limit for how long you're supposed to, you need to wash them every day, I guess. Is that correct?
Yeah, I would not reuse clothing without washing it more than one day. On a last week's session, there was a question on, do I need to change? I think it was under personal services, actually, a question of, do I need to change my clothing between clients? That's not in the order. Could it possibly be helpful? Yes, but it's not required in the order.
Do we have any other questions out there?
I saw one on the air filtration. Did we answer that one?
I think you could go through it. Proper ventilation. Jesse talked a little bit about it, but if you'd like to add a little bit more to air filtration, that'd be great.
Sure. Yeah. So a high efficacy filter, MERV 13 or above, and I would do your own research on this. Could help filter out particles that are carrying the COVID virus, though there's not been scientifically proven evidence of that. Also, before just going and changing out your filter, you would want to consult with your HVAC technician or an HVAC professional to make sure that or look it up in the specification manual, that your HVAC unit will be able to accommodate that filter. If a high efficacy filter clogs up fast, then it's going to crumple, and then you'll just have air bypassing the filter. Or it may introduce amount of pressure of the air trying to get through the filter that affects how the functionality of your HVAC system. So yes, higher efficacy filters could be effective. The higher you go on the MERV scale, the more they filter out. But you would want to make sure that that was appropriate for your facility.
Thank you, Zach. So I have a question from a speech therapist. They're not sure they're going to be able to go live versus telehealth until masks are not required. It's important to see the mouth for successful therapy. Do you see any way around this, or do we have to continue telehealth until the mask requirement ends?
So I think the order recommends telehealth where possible, and I think that is based on that direction in the order. I think that's probably the best case scenario. The order does require that the patient wear a mask at all times. There may be ways to use plexiglass, but that's not really explored in the order. I think telehealth is still your best bet, and it's probably the safest way to carry out that therapy. And
this is a good example of good feedback with us. The face covering order is a Boulder County order. Of course, the state order also has masking requirements, but it's definitely something that I'm curious to run up our chain internally and see how we would interpret that. So if we find out anything different from the response that Jesse just provided, we will certainly communicate that back out to the group. But you raise a good question that I'm curious to investigate further.
And someone in the chat said that they're looking at making clear masks too for those that need to see mouths.
Wow.
That was there you go, best practice sharing right there. Do you have to use a closed laundry basket? Can we use laundry bag with drawstring?
Use whatever you like.
Yeah.
Does the client or patient need to fill out a COVID screening form before each treatment, or is a verbal screening enough during maybe that virtual waiting room?
That's actually, interestingly enough, in the limited healthcare setting, there's no requirement for patients to be screened before they enter. And actually, I will check that right now.
Yeah, so there is a requirement to conduct symptom checks for high contact services. But for low contact services, there's no specification in the order for limited healthcare of doing a symptoms check.
Well, then we have a question then about personal service massage. Is there a client temperature requirement for personal service massage? Or should we get back to them and have them look at the
Same answer for personal service. Symptom checks are required for customers seeking or receiving high contact services. And there is additional guidance available both on the state site and in our checklist.
Okay, what do I need to speak to my office building landlord about to make sure the office building is compliant with HVAC, bathrooms, posting signs, waiting rooms, etc.?
So in terms of cleaning spaces, I think speaking with your landlord about much more frequent cleaning of shared spaces like bathrooms would be very helpful. In terms of HVAC, making sure that the air handling system is up to date and has the filters it requires is important. In terms of posting signs and waiting rooms, if you share an entrance with a bunch of other businesses, the waiting room guidance is really about your space. And posting signs, if you're not allowed to post signs at your business, maybe posting them inside your business would be helpful. Zach, I don't know if you have any other.
Yeah, and I would, on the signs point, I would highlight that the Boulder Chamber has produced a series of signs for businesses to post. They're available on the Chamber website, and they're also available on our website. And we've done this in collaboration so that they're, they're consistent, but also not branded, so they can be used throughout the county. Also, one other point on HVAC, setting to increase the amount of outdoor fresh air that's coming in is very helpful. It helps reduce the concentration of potential particles that are carrying COVID in the air. So increasing the incoming outdoor air through the HVAC system is something that is recommended for all business types.
Great. Are there any more questions out there, whether it's in Q&A or chat? I want to make sure we cover everybody's questions. A reminder, though, we will have weekly sessions. The limited healthcare are on Tuesdays at 3 p.m. Your email following this will include the link to those sessions as well as those signs that Zach mentioned. Oh, one more. We don't have an HVAC system. Can we still open?
Yes.
Yes.
All right. All right. Seeing as there's, oh, go ahead, Zach.
Yeah,
sorry.
one more thing. Tomorrow evening at 6 o'clock, together with the Chamber and the Latino Chamber of Commerce and our economic partners across the county, we are hosting a Spanish language session and Q&A. We will be covering all business types. It'll be recorded if you can't make it, but the info is available both on the Boulder County site and the Chamber site, and it'll also be streamed on a couple of Facebook Live pages. So if you or your employees would prefer to participate in a Spanish language session, we have that available tomorrow at 6 p.m.
Great, thank you. And I put that link in the email that will be going out. There's a question about the next personal services meeting. The next personal services meeting is today at 4. You can go to our website and sign up for that. After that, they will be every week on Tuesdays at 4. We have one last question about a podiatry clinic that also does surgeries under DORA. Do they have other specific guidelines they should be made aware of?
So I would check the DORA website. It has, similar to the COVID-19 website by the Colorado Department of Public Health and Environment, they have it broken down by industry. So you can really look in detail at their licensed businesses about what guidance they have. And I would suspect that surgery-based treatments would fall under the medical field. And so their guidance has been in place for some weeks now.
Thank you, Jesse. Thank you, Zach.
Thank
Again,
you.
you'll be receiving an email from me on behalf of all of our partners, detailing out the resources that were mentioned today, links to more question answers, frequently asked questions, a lot of things that you may need, and it'll be all in one place at your fingertips in one email. It'll include the recording of this session. But to close it out, I'm going to pass it on to John Tehr.
Yeah, I'll just be really quick. My only comment to all of you is thank you for paying attention. Again, our goal is to get your businesses up and running again as soon as possible, but we need to comply with public health mandates. Why? We want to protect public health, stop the COVID spread, and we do not want to go backwards to a place where we have to retrench and close down businesses again. So your attention is greatly appreciated. And then again, I thank the partners, our Boulder County Chambers and Economic Development Agencies, for their partnership and collaboration in pulling this together. And then our great work with the team at Boulder County Public Health. They understand the imperative we have to get our businesses and economy running again. They also want to make sure that we do it in a safe and protective way for yourselves, for your workforce, and for your clients. So cheers to getting rolling, getting back to business. Let's do it safely. Thank you for joining us today.
Thanks.